Well, good morning, Madam Secretary. We are thrilled to have you in America's most livable city. And I have the best job in the world because I get to represent the people of Pittsburgh. And they're great people. This is where I've lived all my life. This is where I will live the rest of my life. And it's truly an honor and a privilege to be able to represent you in Washington, D.C. And it's a pleasure to be with you today to celebrate the first anniversary of health care reform, which Congress passed a year ago and President Obama signed into law. I was a strong supporter of the health care reform law because when my committee helped write it, I made sure that health care reform would benefit the people I represent right here in southwestern Pennsylvania. And I want to vouch firsthand for the important work that Secretary Sebelius has done when she worked with Congress to negotiate the many new provisions in this law. And I'm especially proud to have you here in Pittsburgh with us today, Madam Secretary. You know, this law was a landmark piece of legislation. And like any law to reform a major industry, it was lengthy and it was complex. Consequently, the new law can be confusing and a little intimidating for folks to wade through, especially with all of the misinformation that's been spread about this bill over the last 2 years. But I want to assure you today that the health care reform law will have a tremendous positive impact for most Pittsburghers once it's fully phased in, and that it's already had a noticeable benefit even after only being in effect for 1 year. This new law gives America's seniors greater control over their own health care, saves money for many of them, improves the quality of health care they receive, and it strengthens the Medicare program by adding benefits and improving the program's financial health. Now, first and foremost, I want to emphasize that the new law does nothing to change the basic structure of Medicare. Your guaranteed Medicare benefits will not be cut, contrary to what you may have heard. Medicare will continue to cover most of your health care costs. There are no changes in Medicare eligibility. Your ability to choose your own health care provider stays the same. And Medicare patients, in consultation with their doctors, will still decide which medical treatment options to pursue. Now, however, Medicare will start measuring health care outcomes so that Medicare beneficiaries can find out which doctors and which hospitals are really good and which ones aren't. And that's going to make it a lot easier for you to choose which doctors and hospitals to use. This new law is going to save seniors money, and you're going to see some of those improvements right away. For example, as the Secretary said, the new law makes prescription drugs more affordable under Medicare. In addition, the new law improves existing Medicare benefits and creates new ones to help you stay healthy. Medicare beneficiaries will get preventative care services like screenings for cancer and diabetes for free. You won't have co-pays or deductibles for them anymore. You're also going to be able to get free annual wellness checkup with your doctor, where the two of you can sit down and plan for all of your health care needs. This new law helps early retirees as well, especially those who are still too young for Medicare. The new law provides assistance to employers to encourage them to preserve employer-based retiree health plans so that people who retire between the ages of 55 and 64 can get affordable health insurance they need, even if they have pre-existing conditions. But you know, the new law doesn't just establish or expand Medicare benefits. Seniors on Medicare will get better care as well. This new law gives health care providers financial incentives to improve the quality of care they give you. The law encourages health care providers to coordinate patient care and connect you to the services and support you need, especially those needed to keep chronic diseases like diabetes under control. The new law also strengthens Medicare and protects your Medicare benefits in the coming years. How do we do that? It does so by enacting reforms that eliminate waste and fraud and abuse in the Medicare system. The Secretary spoke about that. Much of this money saved comes from ending overpayments to insurance companies that administer Medicare. It doesn't come from cutting payments to doctors or other health care providers. As a result of these reforms, more money is going to be available to provide care for Medicare patients, and the financial health of Medicare will be significantly improved. By cracking down on waste and fraud, for example, these reforms will help Medicare programs save hundreds of billions of dollars, and we extend the life of the Medicare Trust Fund by 12 years in this bill. The health care, that's something worth applauding for. This health care reform law will also save Medicare beneficiaries money in years to come. It is estimated by the White House that in 2018, for example, seniors can expect savings on average of almost $200 per year in premiums and over $200 a year in co-insurance payments compared to what they would have paid had we not enacted the law. And I think that's pretty good news. And finally, for those of you that are enrolled in Medicare Advantage, let me assure you that there is nothing in this new law that forces Medicare Advantage companies to stop offering benefits and services. During the recent open enrollment period, I understand that seniors in Western Pennsylvania were able to choose between a stronger original Medicare and a number of Medicare Advantage plans. The list of 2011 policies available is virtually unchanged from last year. Now, why is that important? Well, we had all these doomsday predictions that these health insurance companies were going to pull out of the Medicare Advantage program market. Well, the reality is very, very few have. In fact, the health industry itself predicts a 5% growth in the Medicare Advantage market. So much for the doomsday predictions. Many of the large for-profit insurers have told their investors that they see Medicare as a growth business and plan to stay in the Medicare Advantage market. So, despite industry assertions to the contrary, the Medicare Advantage program is alive and well. Let me just say in closing that I appreciate the opportunity to join Secretary Sebelius in talking about how this new healthcare reform law is helping seniors here in Pittsburgh and across the country. Madam Secretary, we appreciate you making this trip to Pittsburgh to be with us today. And I want to say that, this is still a work in progress. Many in Congress are talking about trying to repeal this law. Let me tell you something. They will not succeed in repealing this law. If our colleagues have helpful suggestions in how to improve this law, this member of Congress is all ears how to make a program better. But we're not going to throw the baby out with the bathwater. We've waited a long time to reform this healthcare system. This will be good for Pittsburghers. This will be good for America. I look forward to working with the Secretary and my colleagues in Congress to keep improving this law and make it even better for all the people that we're privileged to represent. Madam Secretary, I'll turn the microphone back to you. Thanks again for everyone for being here today.
Well, again, you get to see Congressman Doyle when he's here in Pittsburgh, but I can tell you he's as feisty about Pittsburgh when he's in Washington as he is right here. So he looks out for you each and every day. I do want to tell you that I have one correction to what the Congressman said. He said that the predictions were that Medicare Advantage enrollment would go up by 5%, and he was wrong. Because we got the new numbers, and Medicare Advantage enrollment is actually up by closer to 7%, Congressman. So the doomsday speakers were even more wrong than they were expected to be. Not only is the program not out of existence, but the highest number of Medicare beneficiaries ever this year has chosen among a whole variety of Medicare Advantage programs, and on average, the rates are down 6%, so it's very good news for beneficiaries. Plenty of programs to choose from, lower rates, and more bang for your buck.